While there's a strong set of clinical practice guidelines recommending annual chlamydia screening for sexually active young women, we know that in practice, we often don't meet the highest level of standard for that measure. Here at the Children's Hospital of Philadelphia, we wanted to know how variable these screenings were and if there were any inequities in screening practices.
As pediatricians and healthcare providers that care for children, we all have the best of intentions. It's important for us to understand that the impact of our behaviors is what truly matters.
Through our research, which looked at chlamydia screening data from 2015 to 2019 amongst all adolescent females attending annual preventative visits, we found that Black teenage girls were 67% more likely than white teen girls to be screened for chlamydia, accounting for their insurance, age, and a number of clinic factors as well. To look at whether implicit bias could affect screening, we then looked at the level of individual providers to see if individual providers were more likely to screen their Black versus white patients. And in that analysis, we found that providers were 88% more likely to screen their Black rather than their white patients. So what are we doing with these findings? As a group of researchers, clinicians, and principal investigators, our group is working to transform care in ways that can improve the equitability of chlamydia screening. Through the CHOP Possibilities project, we've developed the Adolescent Health Questionnaire. This is an electronic self-screening tool that teens fill out themselves at the beginning of their well visit. We know one of the things that can drive inequitable chlamydia screening is differences in screening for even sexual activity amongst Black and white females, where we know that Black teenage girls are often implicitly what we call adultified or seen as more likely to have sex. So the first step in decreasing inequities in screening is improving our ability to universally collect sexual activity data. Through the Adolescent Health Questionnaire, all teens at all of our 31 clinics now actually enter that data themselves into a tablet at arrival to their visit, which allows providers to walk into the room knowing the next best step.
These results really point to the importance of anti-bias training in medicine. There are a plethora of trainings at this institution. There are books, podcasts. There are many things that we can do to ensure that we are aware of our implicit biases and we are aware of the impact of racism, especially systemic racism, on healthcare inequities.
But going even further from there, we're now working with a group of informaticians and pediatricians to build clinical decision support. Basically, alerts and prompts within the electronic health record that nudge pediatricians to do what we think of as the right thing when it comes to screening. Prior research on implicit bias shows us that when people are tired, stressed, or short on time, biases can get worse. Pediatricians want to do the right thing by their patients, and by making it easier to decide who to screen, how to screen, and even put the order in, we hope that that's going to be one critical step in reducing bias in screening practices.